Samoan church leaders in Auckland met with National Health Services last week to discuss critical healthcare challenges within the Pasifika community. Organised by the service's Pacific Public Health team, Project Health, it was a collaborated effort bringing in 47 church ministers who serve over 14,000 faith members. Grace Fever-Ai was there and has the story.
It was all smiles and good spirits here at the one-day conference that brought Samoan church ministers from the Pasifika Sa denomination together. Director for Pacific Public Health, Apipo Tasi, says working with the churches is essential to Pacific culture and livelihoods, and it has had positive impacts in the past.
I think if you look at COVID as a really good example, Pacific churches became the central hub for our Pacific communities and still play a really important part.
At the meeting was Reverend Elder Victor Bowesi from Pasifika Sa Mangeli Sasae Puasese, who says the church is more than just a church.
I believe that this is one of the greatest milestones in terms of public health. They're not only coming to church for spiritual nourishment, it's a hub of information. It's a place they feel comfortable coming to. So when they come to a place that they trust the ministers, they have this connection with the minister, that all the other barriers will come down and the information given to them.
The former principal of Ma'alua Theological College, Ma'afalali Ma, who was now serving as a whaiwheau for Pasifika Sa Otara, spoke about his experience in Samoa and how programs like this would be beneficial if implemented in the region.
In Samoa, hardly any programs like this goes to the church. It's basically to the village community and the women's community, but hardly any involvement of local congregation.
Key topics of discussion at the meeting included outbreaks, screenings, vaccinations and communicable diseases. Social media influencer and Pacific public health worker Tuilangi William Leolahi says he's been encouraging everyone to go for regular checkups.
Life expectancy for Pacific Islanders are slowly dropping as we move forward, but definitely get your health checks done, definitely find ways to get to a GP, but I know that we're putting measures like this to hopefully accommodate that.
One pivotal aspect of the Project Faith initiative is addressing barriers to healthcare that many in the community face and the introduction of the Emergency Response Plan, led by National Pacific Senior Advisor for Protection, Priscilla Toitua. She says by working closely with the church leaders, we can ensure that these distinctions are understood and that our communities receive the care that they need.
The first initiative that our Minister of Health gave to us this year was, what's the plan for Pacific? One of his priorities was to make sure that we had a plan put in place for our Pacific peoples, and this is the reason why we are sharing this lovely Pacific Emergency Response Comms plan with our people. To me, it's just really important that they know what to do in those circumstances, because I think a lot of the times comms gets mixed up.
Plans are underway for similar events in other regions and within the arts and sporting communities.